noches, bienvenidos. Welcome to our event, Community Conversations, Lessons Learned from COVID-19 Pandemic. I'm your host, Hugo Balta, owner and publisher of Illinois Latino News. Thanks for tuning in tonight as we examine a tumultuous 2 years and the ways in which this global crisis hit close to home for Hispanic Latino residents of Chicago's Northwest Side. Before we jump in, I'd like to share some background about why we're here tonight. This is the very first event in the Community Conversation series, a partnership between Illinois Latino News and WBEZ. Throughout the year, we'll aim to elevate the voices of all Chicagoans by producing town hall-style events like this one, including in-person events. Our goal is to go where the community lives, to listen, to learn, and lend our platforms for discussion and debate as we identify the challenges that our diverse communities endure, but also the solutions. Tonight's discussion will be driven by comments and questions from you, residents of the Northwest Side. It's based on survey responses from dozens of Chicagoans. We received multiple questions about mask and vaccine enforcement, protecting children from COVID, access to testing, and general health equity issues for Hispanic Latino communities. And since this event is produced with you and your neighbors in mind, we encourage you to share any questions you have for the panelists during this event. You can leave comments in the chat wherever you're watching the stream. And if you're tuning in on Zoom for Spanish live interpretation, you can type your question in that chat box. Nuevamente, este evento está presentado en inglés y español. If you'd like to access this live event in Spanish, you can find a link on the YouTube comment feed or visit wbez.org/events. Once again, thanks to our interpreter, Catalina Maria Johnson, for your work tonight. This month marks 2 years of living under the COVID-19 pandemic. Tonight's conversation is about reflecting on what we've learned during that time. And I know none of us want to hear this, but how to better prepare for the next pandemic. A lot of our talk tonight will be about inequity. As the data shows us, this virus disproportionately hit Black and Latino communities in Chicago and around the country. Just as an example, the Chicago Department of Public Health reports that zip code 60639 alone has lost nearly 300 residents to COVID. 39 includes parts of Belmont-Cragen, Hermosa, Avondale, Austin, and Humboldt Park. More than 24,000 people have been infected there since March 2020. It's the zip code with the second highest case count in the city, only topped by 60629 on the Southwest Side, which is also a majority Latino community. Both of these areas are part of the handful of Chicago communities of color where at least 1 in 4 residents have been infected by COVID. The big picture question, for us tonight is, can our communities move on from the pandemic if the root causes of these inequities still are not addressed? So let's continue to explore this with the help of our panelists. We have a great group of local medical and community leaders here tonight to discuss the pandemic's effects on the Hispanic Latino residents. Don't forget, if you have a question for the panelists, leave a comment wherever you're watching, and we will do our best to share it during the discussion. Now, joining us first, let's welcome Dr. Geraldine Luna, a medical director for the Chicago Department of Public Health, who's led the COVID-19 response with a focus on Latino communities, and Dr. Marina Del Rios, an associate professor in emergency medicine and the first person in the city who received the COVID vaccine. We also have Dr. Anuj Shah, an integrative family physician for Heartland Health Centers. Welcome, doctors, and thank you all for being here tonight. So let's start with, we got this with our first question from Silvina Mamani. She says, when will we start talking about healthcare for all? To me, all public health protocols are important, but it is time to start talking about how to keep your body healthy. Health jobs, opportunities, and technology are important topics to discuss in case of another pandemic. What did the pandemic teach us about how all of these issues are interconnected? Dr. Luna, let's start with you.
And Hugo, thank you for having me. And I agree. I mean, health for all. Talking about legislation, changes in legislation to guarantee that we all have the same right and access. Bringing down barrier is our priority. The city of Chicago, for example, in this recovery phase that we're right now and moving into endemic, but again, keep aware that cases are increasing again. So we're in preparation now. But we're having these conversations, mental health, how we can better invest in our community. And this can't happen by the Department of Public Health by itself, but it needs to be a legislation. It needs to be addressed from all fronts. And this is what we do here. We try to pick up those individuals, especially those communities with the highest needs. And we know who those communities are, who the people of those communities are. And we're definitely talking about our community of color. We're talking about our undocumented. We're talking about our refugees. We're talking about our uninsured. Those are the highest risk for poor outcomes in regards of accessing health. But I agree, Silvina, you're on point. And these are conversations that need to happen. Most importantly, legislations that need to come down from up above.
Dr. Marina, what's the biggest lesson you think we should take away from the pandemic?
I think one of the biggest, perhaps, that we're all interconnected, and this concept of every individual for themselves making decisions regarding how to keep themselves safe is not public health. I mean, we really need to consider that my individual decisions, whether I choose to get vaccinated, whether I wear a mask, whether I decide to, stay away from crowded spaces in the middle of a pandemic, that is going to make an impact not only in my risk of getting sick, but also in me transmitting it to others. And I think this model that we have of healthcare, of employer-based insurance that leaves the most vulnerable out of receiving adequate healthcare, and in time to be completely dismantled. As an emergency physician, I knew this before the pandemic, that the folks that come through our emergency department are the people that have been failed by our health system. And we need to ensure that everyone has access to healthcare, regardless of their disability, regardless of their citizenship.
Dr. Shaw, let's turn to you. What were the challenges for communities you served before the pandemic, and how did you see those changes when COVID hit?
Yeah, thank you for the question. Before the pandemic and during the pandemic, our communities have faced so many things when we think about the social determinants of health. Things like employment, things like access to healthcare, things like Wi-Fi access. And when the pandemic hit, those things came to the forefront, so that if folks did not have access, for example, to healthcare or to insurance, they may have had less access to COVID testing. If employment was an issue or they did not have protections from their employer, then they may not have access to either taking off of work or even being able to stay home and work from home. These are things that were not afforded to everybody. And then when we think about Wi-Fi access, for example, it's something that we didn't really think about so much before the pandemic, but when the pandemic hit, and so many services are offered online, even our own community health center went very much online with online visits. For those who did not have Wi-Fi access, that was very difficult.
Let's talk now about masks, vaccines, shutdowns, and distancing. Examining the mandates, public compliance, and what we've learned about immunity, effectiveness, etc. We got several questions from people from the Northwest side about enforcement of mask and vaccine mandates. Basically, why didn't the city enforce them more? Carmen Lopez summed up the sentiment we heard from several people. She says, quote, "If you run a red light, you get a ticket. Why can't we get tickets to people who won't get vaccinated. Dr. Luna, what are your thoughts?
Yes, Hugo, and this is a question. I agree. Like, if we were to put a mandate, like forever, like now, it would be definitely a mandate to get vaccinated. I believe that more than masks, what we need is vaccination. What we need is the protection. Unfortunately, still this vaccine, fairly new, it's under the emergency use authorization. And there are some liabilities and legalities to put all that together to make it a mandate. But these conversations are happening, especially when we're considering that our children, when they go to school, they're completely protected. They're follow their schedule of vaccination. And why not COVID-19? We know that it's responsible of more than 900 deaths in the United States. So these are conversations happening. Unfortunately, like mask mandates in a low transmission, it's a battle, it's an arena for liability, for legalities, and we saw that. Even though before we lifted the mask, because we were a low transmission community, transmission was low and the risk of contracting COVID. And you know that varies by definition when we go to specific communities. But we had like 304 individuals suing the city, suing exactly the state of Illinois just because of infringements of constitutional rights. So this is where capitalism, this is where individual rights come into play, what the public health might look like. It's but definitely a mandate for vaccines. I'm all up for that, and I hope we have these conversations and we make it part of the routine schedule for our children to go to school, because we know that protection is needed now that we're learning how to live with COVID-19.
Yeah, I have a child, a sophomore in high school. And as a parent, I could tell you there was a lot of mixed messages in regards to mask wearing. I was very skeptical at first, but I do believe that the school system did the best they could with the information that they had and the resources that they had. Dr. Marina, I want to go back to you. One of the barriers that we saw in the beginning of the pandemic was language. Situations where Hispanic and Latinos uh, already didn't have access to equitable health care, but language barriers prevented them from protecting themselves. Has much changed in 2 years in regards to the information that's being provided at the local, state, and federal level? Dr. Maria, I don't know if you're on mute.
There you go.
Okay.
Yeah. So we've seen some improvement. I think certainly we're seeing more platforms for information regarding COVID, regarding access to vaccines, how to protect ourselves. There is more availability of that. But we're seeing a delay. There's always a consistent delay in getting that messaging, which speaks to the importance of having a diverse body of decision makers in public health, a diverse body in hospitals and clinics, so that when messaging is created, that we ensure that it is multilingual and culturally competent. Many different language backgrounds, and it's about time that we think about creating these in parallel and not sequential, which is what we are. We start with message, and then when we get the time, we translate information. When we get the time, we find an interpreter. And we really need to do this at the same time, because as we've seen, it led to a lot of lives lost and a lot of people that are now disabled with long COVID because they weren't able to get adequate information in a timely manner in the language they speak.
Just a reminder to our audience, please share your questions with us in the chat section of wherever you're watching this program, and we will certainly do our best to present the questions to our special guest tonight. Dr. Shaw, what is, we're talking about questions from the community. Certainly, we've gotten a lot of questions from surveys that we have distributed in the last couple of weeks. In the last 2 years, what are some of the most popular questions, or the most popular question that you've gotten from your patients?
Mm-hmm. Some of the more basic things around what is this virus? How is it transmitted? Questions about the vaccine itself. how does the vaccine work? What are the long-term consequences of this vaccine? Is it safe to get this vaccine? And honestly, I haven't, especially in the Latino community, I haven't seen a lot of mistrust among me and my patients. I think that as a family physician, we build relationships with our patients, and there is a sense of trust there. But there was a lack of information. So a lot of people would come and ask, and we were able to have those conversations, and I believe really move the ball in helping folks really understand what was going on, and as much as we knew. I think one thing that was so difficult about this pandemic is that information was changing as we learned it. And it was very hard to keep up with the information, not only for the general public, but for all of us. So whenever questions were being asked to me, I always would refer to the Chicago Department of Public Health or the CDC and say, well, according to the guidelines this week, this is what we know, and this is the information that we have. And I think that was probably some of the more salient questions that we got.
One of the things that I wanted to ask all of you, and I'll start with you, Dr. Luna, speaking of week to week, things seem to be changing constantly. But it felt to me like a couple of weeks ago, we were in DEFCON 4 with the variant and even talking about mitigations that took us back to 2020. And then all of a sudden we were burning our masks and celebrating the war has won. Are we moving too quickly in trying to get back to whatever semblance of normal we are and putting at risk the most vulnerable communities, beginning with Hispanic Latinos?
Yeah, we'll go, and I think it's too soon to be claiming anything. We're still in the midst of a pandemic. You can see it now. Numbers are rising back up. BA2 again, another subvariant, not even a different variant, another subvariant. It's already on the rise. So I think that burning masks or having the assumption that we're over it, it would be foolish at this point. The fact that it moved from a mandate, for example, using masks moves from a mandate to recommendation as an additional choice is very different than saying that we're over this pandemic. And once these numbers start rising again, we all know what's going to happen. Mandates are going to go back into place if we get to that situation. But most importantly, I think that for the benefit of those individuals that are higher risk, we need to consider the recommendations of masking for individual risk and groups as well. When we're talking about taking into account the community transmission, which is lower overall here in Illinois, but cases are starting to rise, we have to take into account those that are still not eligible to get vaccinated, children, 65 years and older, individuals with conditions, underlying conditions, 50 years and older, and when we're talking about the immune compromise. So it's very important to understand and keep clear. One thing happens to become a mandate, and it's because it's threatening the healthcare system, and then the government has to come in, intruding in our liberties and our what we consider a constitutional right, but it's because of the overall well-being of the public in general. Otherwise, we will see a massive death related to COVID-19. So those are important concepts, and students need to understand, our folks need to understand back home when they're making decisions. And I know that we sound like a broken record, but if something so simple as implementation of preventative medicine can change the face of what we are experiencing as a pandemic, it's out there, it's at our reach. Vaccination is available for everything, for everyone. We're making every single effort to bring down barriers, which we know there are those barriers, mistrust, and trying to improve vaccine confidence. And this is something that we're doing in collaboration with all partners and allies of the city. So Hugo, back to that question, we need to consider preventative medicine, mitigation strategies, and don't lose sight that this pandemic is nowhere near being over.
This pandemic not only affected us physically, it certainly affected us emotionally, psychologically, especially in the first couple of months, the sense of isolation that for many people was very difficult. Dr. Marina, 2 years later, what have we learned in regards to the importance of mental wellness and an emphasis, especially in our community, Hispanic Latinos, where mental health is almost a taboo, right? We don't talk about mental health in the Hispanic Latino community in the way that we should, but certainly it has been forced for many families to have these conversations. What are your thoughts in regards to the importance of mental health, whether it's at the workplace, schools, etc.?
Yeah, I think silver linings of this pandemic is these are coming to the forefront, and now we're speaking about the mental health is one of them. Let's be clear. Yes, these are difficult, but we were already experiencing a mental crisis in this country before COVID hit. Visit any emergency department at any time of the day, and you will see the consequences of the fact that we don't have a strong infrastructure for mental well-being. And I think that with this pandemic, we are now speaking about it more openly. But let's be clear, it's not just been this isolation. It's the fact that people have to struggle with so many other issues, keeping food on their table, paying their medical bills, getting their kids safely to and from school. There's a lot of stressors that our community faces. And when you add that to the stigma that unfortunately exists in a lot of our community regarding mental health, thinking about it as just, a problem of the week, important as managing your blood pressure, as managing your sugar, as keeping a diet. And it's really important that people have easy access to that, to therapists, to group therapy, medications, whatever they need. And we need to treat that the same way, and the access to that the same way that we treat access to diabetes, hypertension. It is part of our general well-being. But yes, we are now confronting a more exposed mental health crisis. But let's be clear, it's been here before the COVID pandemic, and it's time that we now pay more attention to the mental well-being of our folks.
So now that we've discussed how we got to this point in the pandemic, it's time to move on into our next section of the evening, the present. We're going to cover some of your questions about what's happening right now. Dr. Luna will stay on with us for this part. Thank you, Dr. Shaw and Dr. De Rios, for sharing your expertise with us. Our next guest joining us right now is with Dr. Luna. We welcome Dr. Achana Chatterjee to the panel. She's the Dean of the Chicago Medical School and Vice President for Medical Affairs at Rosalind Franklin University. She's a pediatrician who also sits on the FDA panel that reviews COVID-19 vaccines. Thank you for joining us, Dr. Chatterjee.
Yes, thank you. Good evening to you all.
So as we dive deeper into the current guidance, here are some data points about vaccination rates from the Chicago Department of Public Health. You'll see that Northwest Side residents, and particularly those in zip code 60639, are more likely to be vaccinated than the average Chicago resident. Dr. Luna, could you explain what does having a high vulnerability index mean for the community in relation to their above average vaccine rates?
Exactly, Hugo, and as that we know that access and resources, access to healthcare, resources are not the same for everyone. When we're talking about our communities of color, we're talking about marginalization, segregation. We have communities that just by crossing the street, the life expectancy changes from 9 to 30 years. Can you believe that? So we know that because of the social determinants of health, it has been very poor to people of color in this country, not only Chicago, but in this country, places us a higher risk of suffering, incredible injustices, of suffering from diseases, incredible disparities in terms of health. And this is exactly what is our mission here at the Department of Public Health. So having these differences, for example, communities taking the vaccine more likely, more willingly, you have to add to those elements again, trauma, injury, because of history of mistreatment and neglect, governmental neglect to our community. So don't expect our people to believe everything the government is telling you, especially when they're handing you medications that it looks like it might be experimental. So those are important things. Trusted faces. How many people really do we trust that represents our best interest if we're not even represented in the place that we need to be represented? How many legislations was the Constitution created for people that look like me and look like you? So we start just right there. And that explains like everything unfolds, not only for COVID-19, but for all other conditions that we know that are highly represented in communities of color and that we need to address because we're talking about survivalship. We're talking about productive life. We're talking about families that are providing. We're talking about changing the narrative total. So that is something that one piece we learned from this pandemic, and we know and knew it before, but we solidified from this pandemic is that representation and trust means everything when we're talking about saving lives.
Too often, the people that are most affected are not welcomed to have a seat at the table in decisions that affect them. And I think we saw that in the beginning with the vaccination distribution, where they weren't getting to the people that were most affected. It was when then Mayor Lori Lightfoot engaged local grassroots communities embedded in our different neighborhoods, especially on the southwest side, that we started to see the distribution of the vaccines in a more equitable fashion. So let's get some quick questions about vaccines. We have Javier who's asking, how many more vaccines are they going to give us? Should we expect getting boosters to just be part of our lives every few months? Dr. Chatterjee, you're studying all this data. What can we expect?
This is the information that everyone is seeking, right? How many more boosters do we need to get? Will this become an annual vaccination? In truth, we don't know the answers to those questions completely. We do know that as the data come in, as you have indicated, the recommendations change. So for example, yesterday, the CDC made recommendations for a second booster dose for people who are over 50 years of age and those who have some underlying medical conditions. Now, that is based on data that the FDA received from Israel, that they found that there was waning immunity and there were increasing rates of infection and severe disease in people with those medical conditions and who were older than 50. So we learn not only from data that we see in this country, but across the world about what is happening with this pandemic and how we can control it with the use of vaccines as well as other mitigation measures. Most experts believe that this vaccine will become required periodically, most likely on an annual basis. But to be honest, none of us knows the exact answer to that question yet.
Dr. Chatterjee, I want to stay with you. One of the most popular questions that we got in our survey was the effectiveness of the masks. I mean, at one time we were told you could use cloth masks. No, they don't work. A lot of people were using medical masks, and then of course we were all using the N95 masks during the latest variant. My family, we were double wrapping. I mean, we were having two masks. We weren't going to run any risks. Tell us more about the effectiveness of masks and dispelling some of these facts versus fiction when it comes to them.
Yeah, unfortunately, Hugo, there's been so much confusion right from the beginning of the pandemic about masks. There was some information that we had at the time that the pandemic started. So, for example, we knew that the higher grade masks, as they're called, the N95s, the KN95s, those masks are actually called respirators. They work much better than any other type of mask. By now, 2 years out, we know that the surgical masks or the paper type masks that you see, some of them are blue, some of them are yellow, those provide better protection than the cloth masks do. And then if you look at cloth masks, something that is well-fitting, that has more layers, 2 or 3 layers to it, is better protection than a single layer of fabric. So these are data that we have learned over the years. The other thing to keep in mind is that it's important to look at what is the risk to the individual. So if the person is immunocompromised, for example, their risk from the infection is much higher than someone who is otherwise healthy and young. And so it's probably a good idea for someone with an immunocompromising condition or other medical condition like diabetes that puts them at high risk for severe infection, that they use a higher grade mask. It also depends on what kind of environment you're in. So, if you are in a family gathering with a few people, everybody's vaccinated and boosted, you don't have to be as concerned about being so strict about the masks. But if you are at a wedding like I was last weekend with 150 people there who I did not know, and I did not know their vaccination status, I wore my mask and I wore a KN94 mask because that was the best mask that I could use in that situation. So I think there are a number of factors that need to be taken into consideration when choosing masks. The most important thing I would say is it should be a well-fitting mask. I still see people wearing bandanas or, they take their shirt and they put it over their face. Those don't work at all.
I also see people who wear masks and, they're just covering their mouths. And I'm like, well, if you're going to wear it, wear it properly as well. And I think
absolutely something that covers your nose and mouth and fits well around this area of your face, around the nose and mouth area of your face.
Let's stay on the focus on masks. We have another question from a member of the community who goes by the name Chino, who says he works in the service industry and wants to know, why didn't we keep the mask mandate in place for longer? And Dr. Luna, I know you talked about this previously in our first section, but let's hear from you. Because again, I've gone out to eat and I see everybody where I've gone, whether it's a restaurant or even just a shop, they're wearing their masks. And the people who are not wearing the mask are the patrons. But again, why this rush to get rid of mask wearing for the general population in certain situations?
Yes, Hugo, and this is important to mention it because it's not taking away masks. It's actually is adding a choice. So when we think about mandates automatically take any choices from you, and if there is no science right now to support a mandate that imposes people to do exactly the same in terms of community transmission and risk of contracting COVID-19, then is a governmental infringement in your autonomy, your right to say no, your right to say yes. And this is important to know. This is the difference between probably our country and places where they have socialized medicine or different type of political arrangements, right? Or regimes in their countries where China, for example, everybody is to wear a mask and that's the end of it. And then comes with other sort of things. But here in the United States, the most important thing is respect the right and not dictate choices. So taking away a mandate means adding choices. Why? It was a personal choice. For example, I wear a mask where I understand that we've congregated and that I feel that yet, even though I'm healthy, right? But I just want to protect myself, protect others, people around me. And then when you have a community transmission so low, then it comes to individual risk of contracting COVID-19. And that's why people understood differently. Like, oh my God, they're taking away the mask. But no, it's very clear all instances in which individuals benefit from masking when they're going out to the public, when they're going indoors with other individuals around them. And all those are part of the federal government agencies, health departments, local departments. We did not want to take away masking to individuals. We want to add a choice. Another thing is, Hugo, we were sued, not one time. I'm talking about 306 individuals in one school. But after that, it came like a ripple effect. We had it before. We were sued before. We were sued after. People just don't take government dictating your choices. And it is what it is. We live in the United States of America where your individual rights are respected. So we can, as a public health department and all together as a community in collaboration, our responsibility is to inform. And when it takes over, when we're talking about higher risk, we're talking about medium, we're talking about high risk, that we're straining our hospitals, that we're putting in risk the massive health of all the public systems here, and patients and community members dying by the bunches, is then that we consider mandates. But remember, mandate takes away options. Is everybody do as told, or there are consequences?
Yeah. I think it's worth reiterating, right? It's about providing choices to the public so that they can make their best informed decisions. We also got a lot of questions relating to children. Dr. Chatterjee, let's start with you. Javier asked the big one: when will vaccines for children 5 years old and under be made available? Here in Chicago, in the state of Illinois, I know in other states, in New Jersey, where my family's from, they've started to get vaccinations for younger kids. What can you tell us?
So the vaccines have not yet been authorized for use under 5 years of age anywhere within the US. The data that were submitted to the FDA by the vaccine manufacturer were considered insufficient in terms of efficacy. And so they went back to the drawing board, basically, to redo the vaccine and make it more so that there would be better protection from the vaccines for younger children. And this is not uncommon. Young children have immature immune systems. They don't react necessarily in the same way that older children and adults do. And there is a little bit of trial and error that you have to try it and see. And we want to get the right dose so that you get an immune response, but you also don't want to give too much, which would cause more reactions to occur. So currently, the vaccines for children under 5 years of age are still under study. And those data should be submitted to the FDA for review. And eventually, we will have vaccines for this age group. I know it is frustrating for parents of young children who want to get their children vaccinated, but we also want to make sure that these vaccines are effective and are safe for that population.
Speaking of children under 5, one of our viewers tonight, Victoria, who's watching on YouTube, she asks, how can we protect babies under 3 years old if they're not using face masks? Dr. Chatterjee.
Yeah, so it's interesting, that relatively young children, up to, say, 2 years of age and above, can actually wear masks and wear them quite effectively. So, encouraging even young children to wear masks and, just talking to family and friends who have younger children, sometimes the children are better at reminding their parents to make sure that they wear their masks, so they can. Now, what about those children who are younger than 2, or for some reason, they have some medical condition because of which they cannot wear a mask? There we use what I call a cocoon strategy. So if they have older siblings or cousins or friends who are children over 5 years of age, try to get those children vaccinated. The adults that are around them, try to make sure that they are vaccinated and boosted. Make sure that the people who are around these young children wear their masks. If they are ill, they try to stay away from those young children. So do everything in our power to keep those very young children protected.
One of the members of the Hispanic Latino community that were most affected, and certainly in the beginning, and even now, really, living in the shadows, were the undocumented members of the community. And certainly they were the ones also not only most at risk, but putting other people at risk because they were essential workers. And especially when we shut down, really kept the city and the state and the country moving. Dr. Luna, a question from our audience, Hiyomada asks, for persons seeking asylum, what are the consequences in accepting healthcare? Will the public be charged in the future for accepting healthcare services?
Yes, well, there's very specific funds for special populations. For example, here, our undocumented, our uninsured, our refugees are held on to different acts and different programs designated and designed to pick up our individuals with the most needy population right now. And that is something that it's the administration. I don't know if Jimena is talking about the individuals that are going to come from Ukraine and the plans that the federal government have to give asylum to all these ward individuals looking for, or refugees in this case. But in Chicago, we do have those programs. We do have that in place. Something that we're very cautious and that the Department of Health takes very seriously is the commitment with our communities that need it the most. So in terms of healthcare access, in terms of COVID-19 therapeutics, testing, anything that has to do with health care and investments, initial investment, and picking up these individuals where they are and trying to push them to well-being. Remember, well-being is physical, mental, but also financial. It's part of our commitment. And there's a lot of programs. The city of Chicago will be voicing those more clearly, more loudly, so that everybody understands where we are standing at in different points of this pandemic and in different points with what we're talking about it's political affairs with other countries and our movements of refugees coming into our blessed United States of America.
One of the tools that we've all had in these last 2 years is testing, free testing sites across the city. We received free kits in our homes in the last couple of weeks. Do you think, as now we continue to move forward and continuing to look at the situation, mitigations being eased, are we still going to continue to see the number of free test sites that we've seen in the last 2 years? And are we going to get more free kits delivered to our home?
Is it for me, Hugo? Or yes?
Please.
Oh, okay. Yes, we are. And there's a lot of concerns and anxiety from the public, and it's very legit that people are thinking, oh, there's a scarcity of funds. There's a lack of funds now with our uninsured population. Where are they going to get those resources? Oh, Hugo, I'm going to just let you know now that the only thing that we're changing is the streamline of money for reimbursement. All these changes should not be reflected at a population level. We're talking about hospitals, we're talking about clinics and pharmacies that they're looking where to build services that they're providing to individuals. And this is what we did. I mean, that fund, HRSA funds, for example, has a lack of money in there, but we're switching to, for example, in this case, HFRS, which is going to be taking a lot of that reimbursement for therapeutics, for testing, and pretty much testing. And another thing that we got, Hugo, is that same questions. Are you closing clinics because of a lack of funds? Hey, Hugo, it's not about that. The closure of certain sites have been happening even before this announcement was done by the government. And we're talking about demand. What supply and demand is that? Supply, if there's demand, the supply comes. And once we were out of the surge, the traffic of individuals testing decreased significantly. It trickled down significantly. And the fact that we have wide availability of testing, home testing, made it more to the point that we sit down there with sites open with less than 175, 50 individuals, and we're talking big sites. So logistically, it made no sense to spend resources waiting for individuals to walk in. And what we're doing right now is allocating those resources to where it matters. For example, our program, Protect Chicago Plus, keeping incentive to our 15 communities that are still below 70% vaccination coverage. And that's exactly what we do. I mean, we're in a moving, very fluid environment. The decisions are done based on community reality, based on community needs. And that is the reality that we're facing right now.
Well, all right, doctors, unfortunately, the time has run out for this section, and it's time to move on to our final panel of the evening. Thank you both for answering these questions from our community members. Now let's talk about the future and what questions from what Hispanic Latino residents of Chicago can expect as we move forward. Again, Dr. Luna, my co-host, is staying on board for this section. Thank you so much, Dr. Chatterjee, for being with us tonight. I really appreciate your insights.
Thank you for the opportunity.
All right, let's welcome Sylvia Puente and Margarita Klein to the panel. Sylvia is the president and CEO of the Latino Policy Forum, and Margarita is the director of member organizing for Arise Chicago. It's great to have you both. Thank you very much.
Thank you. Thank you for having us.
So this question is for everybody, and we'll start with you, Sylvia. What's the one thing we started doing during or because of the pandemic that you think we should continue? No, I think you're muted.
Thank you. Can you hear me now?
Ahora sí.
See, okay. The one thing I think that we've been doing that we should continue to still do, and I think we heard it from some of your other respondents, is we still really need to be thinking about um, thinking about wearing masks, especially when we're in public places. I think it's just really, really important because while there is certainly the feeling that COVID is going away, it hasn't really gone away. I think it's just especially true for some of our essential workers that I know Margarita is going to talk about. But we really need to continue to wear masks, and we need to continue to learn from what has worked and what has not worked in the past, especially when we get to vaccines for our youngsters, those under 5 years of age.
And Margarita, same question to you. What are some of the things that are in place now that shouldn't go away as we continue to move forward in regards to COVID-19 and in this new normal?
I would like to talk about some protections that the city of Chicago is offering right now for workers. And particularly, there are some protections. We have an ordinance. It's the anti-retaliation ordinance. Probably many workers are not aware of. That if you are going out of work, you have 4 hours to go and be vaccinated. You cannot be penalized for being suffering of COVID-19. Those things should continue. Those protections should continue. There are some things that we need to increase, and those is pay time off for these workers. One of the most devastating things is some workers get sick in the workplace and they do not report because they cannot afford to stay at home. It's of being sick or bringing food, put food in the table for their families. And those are the disparities that we need to start to move on. In Chicago, we have the 5 days, pay. Is the beginning of the year. Many of the is an accumulated benefit. So many of these workers are going to have the 5 days at the end of the year, basically, if they don't use it before. So there are some things that we already have, but there are some others that must be increased.
Dr. Luna, wearing masks, protecting essential workers. What can you add? What should we keep that's in place now as we move forward?
Yes, Hugo, and it's very clear the language around who benefits of you wearing masks is so important for adults to understand, for individuals, family at home. But I agree, like if you're in a congregated setting, if you're more than 50 years old, you have comorbid conditions, diabetes, hypertension, which we know that's overrepresented in Latinx communities and African American communities. We need to wear our mask, and not only whatever mask. We need our high efficiency mask, a K95, a K94. We need to do those. If we are 65 years and older, we should be wearing masks, especially if we start to see a rise in cases of COVID-19, that the way that we're seeing it. If we're immune compromised, regardless of the age, we need to continue to wear those masks. And remember, Hugo, that there are high risk congregated settings that need to wear a mask at all times. We're talking about long-term care facilities. We're talking about correctional facility. We're talking about also anything that has to do with transportation, public transportation, airports. Those are still mandates. So masks are going nowhere. COVID is going nowhere. We just need to understand that this is the time that we need preparedness. We need to plan. When community transmission is low, is then when we need to start moving vaccination, other source of protection in place that will be long lasting, that would ensure that we never repeat what we already have seen. And history is there for a reason. We just need to learn, not repeat it again and again.
One other thing that I would add, Hugo, that some of the listeners might not be aware of is that we're very fortunate that our Illinois General Assembly and our governor have allocated resources to help families that are in need during COVID, especially immigrant families. The state has implemented a cash assistance program that literally this year has a budget of $80 million to help families who have lost jobs, who are in economic need due to COVID. Those dollars will be released to eligible applicants, primarily through two sources. One is Illinois has a network of Illinois Welcoming Centers, and another is through the Illinois Coalition for Immigrant and Refugee Rights. Families can go and apply, show their economic need, and get help with the cash assistance, which we know is so critical to both our immigrant families and our Latino families. Because survey research has showed us that in the pandemic, 2/3 of Latino households had less than $500 in the bank. So as people lost wages, as their hours were reduced, they still are on a path to, especially at the beginning of the pandemic, they still are on a path to economic recovery. And that's, I think, one of the long-term consequences of COVID that we haven't paid enough attention to, Hugo. People think that the pandemic is over and things are back to normal. We still see higher rates of unemployment in the Latino community than we saw pre-pandemic. And we especially see those higher rates of unemployment and actually many Latina women that have exited the labor force because they haven't been able to get childcare, because they've lost their jobs, because they're in an industry, working in an industry that was dramatically impacted by COVID.
So yeah, center of the work that you do with the Latino Policy Forum is looking and working with legislators. What policies are there in the horizon that you think should be enacted to improve, as you said, the lives of the most vulnerable, the Hispanic Latino community?
Well, certainly the cash assistance program is one that we're very happy about. In the first 2 years of the pandemic, the state put in tremendous dollars in relief for mortgage and rental assistance. That is not as robust this year as we would like it to be. So there's a movement to try to get our legislature to increase more so they can help people not only with cash assistance, but with rental assistance. But one of the crying needs, Hugo, and the Latino Policy Forum is working on a report on the long-term impacts of COVID. And we're going to lift up what are the economic needs, the healthcare needs, but also needs in terms of education. But the crying need that we have heard as we've done some focus groups, as we've talked to community organizations, is the need for mental health. We forget how many people have died in our community. And I know the Latino community is not alone in that, but there have been a staggering number of people who have not survived the crisis. And a staggering number of them, and this is true for the Latino community, that most of the people who have passed away, regrettably, are of working age. So households have lost their income earner and they're grieving. And so the economic assistance helps with a piece of that, but the need for bilingual, bicultural mental health counseling is something that we must invest in, and we don't have anywhere near the adequate number of resources or professionals to help address that.
Margarita, many Latino families couldn't afford to have parents stay at home during the pandemic or have their kids learn online. How can we create systems in the event of another pandemic that account for different communities' individual needs? What are your thoughts on that?
This is very, our community, our Latino community was tremendously affected. Everybody has been saying exactly the same because it was our reality, with people not being available to stay at home because of the kind of work that they were doing. In our community, and Sylvia's right, women were the most affected one and still being affected one. When a child, gets sick at school, and then that child need to be quarantined at home, who stay with that child? Normally it's the mother. So that they are the one at the highest risk of losing, their jobs. I would like to point another thing that is I think is very important that we talk, and that is the workplaces. We are putting a lot of personal responsibility, which I think is tremendously important. But we also need to look at the workplaces. Since the beginning of the pandemic, we have waves and waves of workers taking matters in their hands. What I mean with that, people conducting work stoppages to guarantee that they have safe conditions to go back and work, clean conditions, forcing companies to use professional cleaning companies to go and have everything in a way that they feel safe. So there are laws out there that also protect that right. And I really would like to appoint that, because there is the personal responsibility is important, but the collective responsibility is also important, particularly in the workplace. Under the law, if there is two people or more who are demanding better conditions in their workplace, they are protected by the law. And it's important that people know that. We still have in our organizations everyday workers coming, demanding safe conditions. And when I mean safe conditions, is safe conditions, not just the machine who can hurt me. Is the place is clean. The place is offering me, in a way where I can be safe out of that virus. I won't bring that to my home. I won't sick my family by it. So I think it's important that we talk about that too.
Yeah.
And Margarita didn't use this word, Hugo, but I would say we all know that a lot of our Latino essential workers have been exploited. And she didn't use that word, but I will, right? So that the responsibility is here also on those manufacturing plants, on those kitchens, the hospitality industry, to really ensure workforce protections for their essential workforce.
And I think the Great Resignation is a product of what you both are saying, a dissatisfaction with what's in place to protect workers, essential workers, and they were ignored before the COVID-19. They certainly were the central focus, as I've mentioned before, in keeping this country running. And now, as we're moving forward, they want to ensure that there are systems in place that are going to keep them safe and protect them and really respect the work that they're doing. Let's go to another question from the audience. This one is a video question from Susana Salgado, who works at Centro Romero in Edgewater.
Hi, good evening. My name is Susana Salgado, and I work for Centro Romero, a not-for-profit organization in the north side of Chicago. There's still a lot of men in our community that need to get vaccinated. Can you guide education towards the young and middle-aged Latino men so that they can get vaccinated, and what is the importance of getting the vaccine?
Dr. Luna, we've said this before in this program. Unfortunately, in our culture, getting health or getting help is sometimes a taboo, especially for the men in our families. What can you share with us in regards to the question from Susana?
Yes, Hugo, and unfortunately, what we're seeing is a reflection of realities. We're talking about discrimination, systems of racism that we have had before COVID-19. Barriers, very strong structural barriers for individuals to even get primary care, health access. We have our communities living in healthcare desert, food desert. Walkability is an issue. So all those things that we know, and the profound disinvestment of the government has created incredible distrust. And now with the media, we know misinformation has been impacted family members starting from dad, from mother down, and we have entire families against getting this vaccination. One of the messages that we're doing at the City of Chicago, and in collaboration, and Sylvia is part of that, Illinois Unido, and here also with our rights representative, it's that communication collaboration with community. Hugo, there is no way the government by itself is going to get the lifting enough to break through and gain confidence from the people that they serve. That is not going to happen. Trusted faces, individuals, fierce advocator for social justice for our communities are those individuals, in collaboration with those individuals like Sylvia, like here, our rights representative. Those are the differences that we're making in our community. And that's how we at this point have 75.9% of the Latino population vaccinated with at least one dose to get protection, and protected at least by one dose, which is the first time in history that we haven't seen disparities when we compare it to our white population. And it's still a lot of ground to cover. Sylvia.
we still have 25% of the population to get to, as your video participant indicated. But to Dr. Luna's point, the good news is that when you have trusted messengers, and with all of the work and advocacy by many, including Illinois Unidos, which is a coalition that has been addressing this issue for the past 2 years, our community has listened. I mean, I think it's remarkable what Dr. Luna just said, that for the first time, we don't see that vaccine disparity in the healthcare field because people are taking this to heart. They do understand the implications. And when there, again, is a trusted messenger, and Illinois Unidos has a whole program of more than 20 organizations who the doctors share to the community workers, here's the information that you need to share. In the community, our community is responding. That's the good news. However, to the callers or to the video's person's point, we still have a quarter of the community that really needs to take this up.
And Hugo, another important thing, 10% of Chicago is individual population that has no insurance. And guess what? Yeah. 51% of that 10% are Latino. We're talking about 128,000 of our Latinos uninsured without access to healthcare, something as minimal as a vaccine. Vaccine has been widely available for COVID-19, but we're talking about other type of protections that are unfortunately because of these barriers. And we're working to bring them down. We're working to gain access. We have now Promotoras de Salud, which came from those collaborative efforts with individuals that know our people, that know their culture, that know the language, that know how we think, how we are, and gain those breakthrough situations to reach out and create awareness of the importance of protecting ourselves.
Organizations like Illinois Unidos are key in building bridges with local, state, and federal government and really dispelling a lot of the misinformation and also a lot of the mistrust that exists with government. I got a question. We've been talking a lot about vaccines and percentages. One of the questions from our audience comes from Lisa, who asks, what percentage of the population vaccinated is good enough? Dr. Luna.
I'm sorry, can you repeat that? I'm sorry.
What percentage of the population being vaccinated is good enough?
Oh, like herd immunity. Probably we have herd immunity. Herd immunity is in theory a place like a nirvana, a place that we want to approach to. But with COVID-19 and the mutations and a change in ever-changing, very live virus out there, 100% and not even there, we're sure that we're going to address future variants to come. So the more vaccinated we have individuals, the more protected. And Hugo, it's so simple that we know even those individuals that get a breakthrough infection, vaccination has decreased the likelihood of contracting long COVID. This is a new disease as it is. And again, overrepresented by our community of color, our people of color. We're talking about Latino community. We're talking about African Americans.
Hugo, if I could, since we're thinking about the future, one of the things that I wanted to just put in maybe a little bit of a bigger picture context is the Latino community. While we know there are many challenges and many that are economically not stable, we really were on an economic trajectory, an upward economic trajectory on many of the socioeconomic indicators until COVID hit. COVID has really ruptured and broken a lot of the economic progress of the Latino community. So I've already mentioned the higher rates of unemployment, the higher rates of women that have now left the workforce, the number of Latinos who have had to give up their homes and had to double and triple up because their wages have been reduced or they haven't been able to work. But the one that's, and among all of them, it's going to take us a while to recover the economic ground we have lost in each of these areas. But the one that's really blowing me away is that early on in the pandemic, there was a study that came out that said 50% of Latino students in college either stopped or changed their college going plans. That was compared to 25% of white students. We have literally seen a decline in the number of Latino students enrolled in college. When you're enrolled in college and you get off that trajectory, you've had to drop out, you had to go home to help your family because they were struggling, so you had to get a job. what is it going to take for this generation to be able to complete college? They are going to lose ground. They're going to lose time. It's going to take them so much longer to finish college and have that path of economic mobility that they were on. This is a potential generation that we have lost with respect to college enrollment. And we know it is a generation that is dramatically affected. And this is true for all students, all of our students that were in grade school and high school, right? We're going to see not really good gains in our test scores. I especially think about our youngest learners, who that socialization process and how they learn. We do not yet know the unintended consequences and the unknown consequences of the educational impact on this generation of students and how that's going to play out into the future.
Unfortunately, we're going to have to leave it at that. We could go on for another 2 hours. We've reached the end of our time for this discussion, although always so much more to explore when it comes to equity and the pandemic. And thank you so much for sharing those insights, Sylvia. Dr. Luna, Sylvia, and Margarita, it's been a pleasure to talk to you with you all night, tonight. Thank you all for your panelists, for all the panelists for taking the time to participate in this event and share your knowledge with our audience.
Good to see you all.
Thank you for having me.
And there is hope out there.
And I'd also like to take this moment to thank our community partners who helped us collect survey responses from Northwest Side residents and spread the word about this event. Muchísimas gracias to Belmont Craving United, Communities United, Esperanza Health Centers, Heartland Health Centers, Illinois Unidos, and Northwest Center. Be sure to visit IllinoisLatinoNews.com and WBEZ.org for the latest coverage of COVID-19 and equity issues throughout Chicagoland. You can also listen to WBEZ on 91.5 FM or the WBEZ app. We also want to thank you all for tuning in tonight and sharing your questions with us. Please let us know what you thought about this discussion by filling out the post-event survey, which will be linked in the comments. Or you can scan the QR code on your screen momentarily. And you can visit wbez.org/events for more information about upcoming events. Our next event in this community conversation series will take place in the summer. Thanks again. Good night y buenas noches.